Mesothelioma is a rare type of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs. Specifically, mesothelioma affects the pleura, mesothelium of the lungs, peritoneum, abdominal cavity, pericardium, sac around the heart, and testes. The majority, around 70%, of mesothelioma cases are caused by exposure to asbestos. Without treatment, the median survival for mesothelioma is usually between 4 to 12 months. However, the survival rates vary depending on the stage of cancer at diagnosis. For epithelioid mesothelioma, which accounts for around 70% of mesothelioma cases, the median survival times are as follows. Stage I, 12 to 21 months. Stage II, 9 to 16 months. Stage III, 6 to 12 months. Stage IV, 3 to 9 months. The 5-year survival rate for epithelioid mesothelioma is around 10 to 15% when the cancer is detected early at stage I. However, the 5-year survival drops considerably to less than 5% for stage IV cancer that has metastasized. Better prognosis is seen in patients with epithelioid histology who have not experienced cancer spread to lymph nodes or distant sites. For sarcomatoid mesothelioma, which accounts for around 5% of cases, the prognosis is much poorer compared to epithelioid mesothelioma. The median survival for sarcomatoid mesothelioma is 4 to 6 months and the 5-year survival rate is less than 1%. Phasic mesothelioma, which has both epithelioid and sarcomatoid features, has intermediate survival rates between the two main histological types. Several factors influence the prognosis and survival outcomes of mesothelioma patients. Some favorable prognostic factors associated with longer survival include younger age at diagnosis, earlier cancer stage, epithelioid histology, good performance status, and weight loss of less than 10%. Aggressive treatment approaches including extrapleural pneumonectomy surgery combined with chemotherapy and radiation have been shown to boost survival, especially in early-stage disease. Newer immunotherapies and targeted drugs are also improving outcomes. Lymphoma refers to a group of blood cancers that develop from lymphocytes, a type of white blood cell. The two main types of lymphoma are Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma accounts for around 10% of lymphomas while non-Hodgkin's lymphoma makes up the other 90%. Survival rates for lymphoma vary significantly depending on the specific subtype, stage of disease, and individual risk factors. For Hodgkin's lymphoma, the 5-year relative survival rates according to stage are: Stage I, 90 to 95%. Stage II, 85 to 90%. Stage III, 75 to 85%. Stage IV, 70 to 80%. With modern treatment using chemotherapy, radiation, stem cell transplants, and biologic therapies, over 80% of Hodgkin's lymphoma patients now achieve long-term remission and cure. Stage I disease has an excellent prognosis while Stage IV disease has a slightly lower 5-year survival rate despite treatment advances. Non-Hodgkin's lymphoma has over 60 different subtypes that exhibit varying clinical behaviors and responses to treatment. Some aggressive fast-growing subtypes have poorer 5-year survival rates in the range of 30 to 40% while some indolent slower-growing subtypes have much higher 5-year survival of 70 to 90%. The 5-year relative survival rates for some major non-Hodgkin's lymphoma subtypes according to stage are: diffuse large B-cell lymphoma. Stage I/II, 60 to 70%. Stage III/IV, 30 to 50%. Follicular lymphoma. Stage I/II, 70 to 90%. Stage III/IV, 50 to 70%. Chronic lymphocytic leukemia, small lymphocytic lymphoma. RAI stage 0, 90%. RAI stage I/II, 80 to 90%. RAI stage III/IV, 60 to 70%. Prognostic factors affecting non-Hodgkin's lymphoma outcome include age, performance status, stage, subtype, molecular markers, and response to initial treatment. Combination immunotherapy and newer targeted therapies have significantly improved long-term survival rates compared to older chemotherapy regimens alone. Overall, more than 70% of non-Hodgkin's lymphoma patients now achieve a cure with appropriate treatment individualized based on risk factors. Survival rates for mesothelioma and lymphoma vary widely depending on the specific histological subtype, stage at diagnosis, individual risk factors and prognostic markers, as well as type and duration of treatment received. Earlier stage disease generally predicts longer survival while more advanced or aggressive subtypes carry poorer prognoses. However, newer immunotherapies, targeted therapies, stem cell transplants and overall optimized multimodality treatment approaches have substantially lengthened life expectancy and boosted cure rates for many lymphoma and mesothelioma patients in recent decades. Continued advancements in precision medicine hold promise to further improve cancer outcomes.